Happy Sabbath, Church, and thank you for joining back in with us for this afternoon program, the health section of our program. Today's program will be taken by someone I can say I know quite well, by my beautiful fiance, Karina, Saul. The topic she will be looking at is common musculoskeletal conditions, causes, and treatments. But before I hand over to her, let's have a word of prayer. Dear Heavenly Father, thank you for bringing us back together. We thank you for the time that we're now going to spend looking at the health program, looking at musculoskeletal conditions that we have. We pray that you may guide Karina as she goes through this and as she presents. May those tuning in be able to understand, learn, and be able to put the things into practice that we gain from it. In your name we pray. Amen.
So as he said, my name is Karina, and I work as a physiotherapist, a musculoskeletal physiotherapist, and I've put together today a presentation of some of the most common conditions that I see, and I've just put some self-help tips in there for you as well. So we're going to be covering 4 topics, and then there will be opportunities for questions and answers as well. So the 4 main topics we're covering are osteoarthritis, shoulder pain, back pain, and persistent pain. So osteoarthritis is a very common condition. It affects 8.5 million people in the UK. So that's a lot of people. A third of over 45-year-olds actually have this condition to some extent. Unfortunately, you're more likely to develop it the older you get, and it is a long-term condition. So that means there's no cure for it. Once you have osteoarthritis, you're going to have it for life, basically. And it can affect any joint, so fingers, spine, hips, knees, neck, anywhere. Let's just have a look at what actually happens inside the joints. So I'm not sure if you can see my mouse. I think you can here. This thin pink line here, it's cartilage, but then the correct name of it is hyaline cartilage. And in a nice healthy joint, the joint surfaces are nice and covered with this hyaline cartilage. And you can see here the joint capsule is nice and arranged there in an orderly way. But if you do develop osteoarthritis, the joint then changes. The main change that we see is that hyaline cartilage starts to get a bit thinner, the edges start to get a bit rougher, so the bony surfaces might get a little bit more rough. You can see here that it says there's some bony spurs that sometimes develop. These are called osteophytes, and that's what an X-ray would look like. If you have osteoarthritis, you might see that those changes have started to happen. The bone ends get a little bit whiter. So the signs and symptoms of osteoarthritis. So the main thing is that you're going to have pain in the joint that is affected, but this pain will be a gradual onset. It won't be a sudden onset of pain. It's something that can sometimes take weeks or months to develop. The joints will sometimes get swollen. You can have stiffness in the morning. Now this stiffness should ease as you get moving, so it shouldn't last for longer than 30 minutes. And that's because when you start moving, a fluid called synovial fluid is released into the joint space, which helps lubricate your joint surfaces. With osteoarthritis, the pain will worsen with activity. So things like gardening, walking, if it's in your knee joint or your hip joint, it might get worse with those activities. And another aspect of osteoarthritis is that you can have flare-ups of your symptoms. So that just basically means for a period of time, your symptoms will get worse, so that your joints might get stiffer and more painful than usual. But that will last for a period of time, and then you'll get back to normal. So things that can contribute to you developing osteoarthritis, there's just a few factors here. So unfortunately, it's more common in us women. Not sure why, but yeah, we just see that more women are affected by it. Genetics can play a part. Occupation, so if, for example, you're a plumber, or maybe a gardener, or you work in construction, spending a lot of time on your knees, you might then develop knee osteoarthritis. Diet plays a part as well, but the main thing here is to do with, your weight and how much load is actually going through the joint. So if you're eating more than you're burning and you're overweight, that can increase your risk of developing osteoarthritis. Previous trauma, so if you've had a bone that's been broken, so if there's been a fracture, that can then develop to that joint becoming more osteoarthritic as you get older. Joint deformity again, so if someone is born with a joint that's not formed properly, that joint is then going to be more likely to develop osteoarthritis as they get older. And then finally, physical activity. So if you're someone that has done a lot of, say, sports or exercise in your youth, that might make you more prone to developing osteoarthritis. So, for example, athletes, if they've done a lot of running, they might be more prone to developing arthritic knees, for example. So now we'll just talk about some management and treatment options. So, if the pain is really bad, I see a lot of people that come into the clinic and, they're not taking pain relief. And I suggest that to them and they say they don't want to because they say it just masks the pain. Yes, it does. But actually for a joint that's arthritic and, that arthritis is going to be there forever, if the pain is meaning that you're becoming less active, you're better off taking something for the pain and enabling yourself to do more exercise and get stronger and fitter, because that's going to be better for you in the long term. So apart from pain relief, you can use ice and heat. Now, the difference for when you should use ice and heat, ice acts as an anti-inflammatory. So if something is looking a bit red, swollen, quite warm to touch, that's when you would want to put ice on it, okay? And if something is not really swollen, but it's just quite painful, a little bit stiff, that's when heat can be more useful. Heat will help to widen or open up your blood vessels, which lets more blood and oxygen into the area, which can relieve tension in the muscles. Whereas ice, as I said, acts as an anti-inflammatory. It will close down the blood vessels and prevent more fluid from getting into the area. So apart from that, then you've got exercise, and that's when someone like myself would come in, okay? So the benefits of exercise with osteoarthritis are second to none. As I said, when you start moving your joints more, you do get that release of synovial fluid, which helps to lubricate the joint surfaces and makes it more comfortable to move. But then also a big part is the strengthening of the muscles, because if you've got a joint that is not coping that well with the load that's going through it, if you then strengthen the muscles surrounding the joint, that will then make it more able to cope with day-to-day activities. Pacing, that's where you're not doing too much in one go, or you're actually just not sitting around and doing nothing. It's doing bite-sized amount of activity in manageable chunks. If you pace well, you're less likely to develop flare-ups. And that's just because you're not overdoing it or underdoing it, okay? So, for example, you're not doing the shopping, the housework, and all your exercise within the first 3 hours of you waking up. That's probably going to be too much if you've got osteoarthritis. Relaxation and stress management. That's important because for something like osteoarthritis, we know that anxiety and stress can make your pain worse. It can make your symptoms worse. So if you are going through any emotional trauma or your mental health is not in the best place, it's good to address that as well as the physical symptoms so that your pain levels do go down. And then finally, avoiding aggravating activities during a flare-up. So if your knee or your back has started to get really sore, that's not the time to then, up your exercise or do more things. You want to try and limit the unnecessary activities so that you are able to rest and recover. So here I just want to talk a little bit about escape pain. This is a program designed specifically for people who have hip or knee osteoarthritis. Prior to COVID, At places like my work, we would be running escape courses. So it would run for 6 weeks, 2 classes a week. And people would come, and what we would do is speak to them about the different factors in their life that they can change to help improve their symptoms, but then also give them lots of different exercises that they can start to do to strengthen their muscles and get their joints more flexible. Now, fortunately, all of that information that we would be telling people is online. So Escape have their own website. They also have their own app. So if you just type in Escape Pain into your app store, look for that logo, that's what will come up. Unfortunately, it's not available for iPhones. It only works on Android phones. But yeah, I think if you know someone who's got osteoarthritis in their legs, or you suffer yourself with it, then definitely download it if you haven't done already. It's free to use, available for anyone. There is also a back escape program, but I haven't had too much experience with that. But if you do have back arthritis, then you might want to give that a go. Okay, so are there any questions at this point, Pastor Andrew?
Yes, we have some questions.
Okay.
The first question is, can you explain more on how genetics can be a risk factor for osteoarthritis?
Oh, okay. So to be honest, I don't know too much about the genetic link. I know there is a type of arthritis called nodal arthritis, which is where you get a bit more kind of changes in the fingers and the knuckles. That one has definitely got more evidence to show that there is a genetic link. But with osteoarthritis, it is more to do with your lifestyle. If there is a genetic link, there probably isn't going to be, it's not a definite. So if, for example, your mum had osteoarthritis in her hips, it's not a definite that you would end up with osteoarthritis. Yeah.
Okay, thank you. Another question is, what are the main dietary factors that contribute to osteoarthritis?
So it's things that's going to cause you to put on weight. So if you're someone that eats a lot of carbohydrates, a lot of saturated fats, a lot of sugar, and you're not doing a lot of exercise, those are the things that you would probably want to cut out on. Alcohol as well has a lot of calories, and there is a link that alcohol can lead to sort of increased inflammation in the blood. So that's something that you'd want to be aware of. So it's more to do with the amount of weight that you're carrying, and that's where your diet can be quite fundamental.
Okay, thank you. Another question is arthritis reversible?
No, so osteoarthritis, once the changes have started to take place in the joint, you can't change that, but your symptoms can be improved. So some people can have osteoarthritic change seen on their x-rays, but they don't actually have any symptoms because they're so fit, they're so strong, and they do regular exercise, they do lots of stretches, and they don't really have much pain. So yeah, so the changes in the joint won't change, but your pain and your function can definitely improve with better health.
Okay, thank you. And the final question for this section is there a difference between osteoarthritis and rheumatoid arthritis?
Yeah, so we're not going to be talking about rheumatoid arthritis today. So rheumatoid arthritis is less common. It's actually more of an autoimmune disorder. So essentially your joints end up attacking themselves. To get diagnosed with rheumatoid arthritis, you would need to see a rheumatologist or a GP, and they would probably do blood tests, and your inflammatory markers would be raised in your blood. Whereas with osteoarthritis, I didn't say that actually, you don't really need any tests or x-rays to get a diagnosis because it's so common. Seeing the relevant healthcare professional, so whether it's your GP or your physio, once they've taken a history of how your symptoms started and how it affects you, and they've looked at how your joints are moving, they'll be able to tell whether you have osteoarthritis or not. But yeah, rheumatoid arthritis is different and needs a lot more medical intervention.
Okay, thank you very much.
Okay, great. So now we're moving on to talk about a shoulder condition or shoulder pain. So There's a group of tendons in the shoulder called the rotator cuff. So it's made up of 4 tendons, and rotator cuff issues are the biggest cause of shoulder pain that I see. So, problems ranging from things like a tendinopathy. So that's where the tendon is kind of not coping very well with the load. It's getting a bit inflamed and irritable. Sometimes you can have a tendinitis, which is a very acute flare-up of a tendon, or you can have a rotator cuff strain, which is where you've just, again, sort of either injured the tendon or you've overloaded it, and it then starts to get painful. So signs and symptoms of rotator cuff issues would be pain when lifting your arm above your head, pain when lifting your arm out to the side, pain putting your hand behind your back. Your shoulder might get quite stiff and then you find that you can't move it. You might have pain when lying on that side, and then you might find that that arm then becomes quite weak. So you don't need to have all of these symptoms to know that you've got a rotator cuff problem. It might just be a few, but those are the main things that would indicate that there's something going wrong with your rotator cuff. So again, it would be diagnosed with the fact that you've got pain in the shoulder or the upper arm. So sometimes you see people and they're saying, oh, my arm's hurting, I've got arm pain, but actually it's because of the shoulder. So anywhere from kind of up here down to the elbow can be related to the rotator cuff. It would be better if you had a thorough assessment by a healthcare professional rather than, looking up Dr. Google, just because it could be something else. But once you've seen someone who does the right test and tests the muscles in the correct way, they'll be able to confirm what is actually going on. If a rotator cuff tear is suspected, your GP might refer you for an ultrasound scan. Now, again, that's not necessary because sometimes you can have little tears which can be managed conservatively, so without surgery, can be managed with just exercises and strengthening and kind of not overloading it. But if it's a significant tear and they're thinking that you might need surgery, then they might then send you for a scan. So we'll just talk about some lifestyle factors which might make you more prone to developing a rotator cuff problem. So the first thing we're going to talk about is posture. So we can see that the person on the left has got quite a rounded posture. The shoulders are quite rounded, chin's poking forward, and the upper part of his spine is quite rounded there. So that's not great, not only for the back and the neck, but also for the shoulder. This is more what you would want to have, so a nice neutral alignment in your spine and your shoulders. The reason why posture can affect your shoulder or rotator cuff tendons. So in this picture here, we can see this bone at the top. So you've got your clavicle here, and then you've got the end of this bone here called the acromion, or the acromion process. Now this gap underneath here is called the subacromial space. Now, any of the structures in here, if there's a reduction in the amount of space, can then get inflamed or irritated, and that can cause pain. So for one of the rotator cuff tendons sits underneath the bursa here. So if this is starting to get a bit pinched, or the space is closing down, then that can cause pain when you then lift your arm up or out to the side, because that's going to cause even further restriction in there. Sometimes the bursa in here can get inflamed as well, called a bursitis, and that can cause pain if you're lying on the side. So it's important that your posture is good and that you keep a nice open chest with sort of day-to-day activities, not rounded and hunched over. So other things that can contribute, so a lot of painters and decorators might be at risk. So if they're working with their hands above their shoulders for a lot of the time, repetitive arm movements. So it doesn't have to be just up above your head. If you're doing lots of things where you're taking your arms out to the side. So, for example, I see sometimes people who work on the tills or cashiers, and they are having a tendinopathy because they've overused their tendons. Heavy work. So again, it comes down to a problem with load. The tendons just aren't able to cope with the load. load that's being put upon it, a lack of rest. So again, just overload of that tendon, it's not having enough time to rest and recover. And then as well, smoking and alcohol, we know is really bad for your tendon health. Smoking, because it restricts the amount of oxygen that's able to come through to the tendon and the rest of your body. So if there is an injury or the tendon's starting to get a bit worn, there's not going to be enough oxygen that can get to it, and that's what the tendons need to heal. And again, alcohol is linked to delayed healing or prolonged inflammation. So treatment options. From a physio point of view, you know, if you came in, we would make sure that you're being given some strengthening exercises and also some stretches to help keep the shoulder flexible so that you're not then losing range. Cold packs, heat packs. Sometimes it's down to personal preference. Again, if it's really irritable and it's waking you up at night, quite stiff and painful in the morning, that's more signs of inflammation. So using a cold treatment would be better then. But if it's just a little bit of an ache, then heat might be better because that might just need a bit more blood flow to the area. Avoiding compression of the shoulder while it's quite sore and irritable is advised as well. So not just lying on it, but also, you know, carrying bags. If you're carrying something with a strap and it's putting a lot of weight through it, then that's something that could cause it to get a bit worse. And then ultimately, if none of these work, then sometimes medication will be needed. So pain relief, anti-inflammatories, more importantly, I think will probably make more of a difference. Sometimes steroid injections may make a difference, but, you know, that's not always the case. Sometimes people can get a steroid injection and it doesn't help. Steroids isn't really that great to be put into a tendon, as it has been linked to increased risk of rupture. So it really isn't the first line of treatment, but if someone is really struggling, then they may get a steroid injection. So I've just got a few exercises to show you. Some things that you can start doing at home, maybe if you've got some resistance band. So this movement here is external rotation. So that's one of the main functions of the rotator cuff, is giving you that external rotation. So having your elbows against your side, pulling the band out against resistance. An internal rotation, which is the opposite. So pulling in towards you instead of pulling out. And that's another way of doing internal rotation. So with your elbow out to the side at 90 degrees and then pulling forwards and down so that resistance is behind you. And then finally resisted abduction, which is another main function of one of the rotator cuffs, so taking your arm out. So with these strengthening exercises, you don't need to do them every day because your tendons need time to rest and recover. You should do them every other day or 3 to 4 days a week, doing them until the tendon gets tired. So, you know, if you're just doing 5 or 6 and it doesn't really feel like it's been a challenge, you need to do more. So do it until that tendon has felt like it's had enough. So until fatigue, we would term that, and then doing that a few days a week. Okay. So any questions about that?
Yes, the first question, are you more at risk if someone's joints have recurring subluxations?
So subluxations is where your joint is a bit unstable sometimes. So if it was the shoulder, your humeral head might be a little bit lower. A subluxation is more going to put you at risk of potentially a dislocation because that's to do with the joint not being as stable. If someone's joints are subluxing, it could be because your ligaments are a bit too stretchy. So your ligaments are what connects your bones together. If you're strong, if the tendons are strong, then you're probably not going to be at more risk than anyone else. You might be at risk of another type of shoulder pain, but it probably won't be from a rotator cuff issue.
Okay, thank you. Can a rotator cuff self-resolve on its own without medical treatment?
Sometimes it can, yeah. If it's just a strain, so if it's just a one-off incident where you loaded it too much, soft tissue injuries will normally get better within about 6 weeks if it's something that is not too serious. So yeah, they can do sometimes.
Okay. And how might sleeping habits affect this shoulder issue?
So if you're sleeping on that side, that will be compressing the tendon, and it can compress the bursa. So I spoke about the fluid sort of filled sac that's in that space. If it's inflamed as well, that won't really like being lent on. If you're not sleeping enough, then that can make pain worse. So with any pain condition, if you're not getting enough sleep, that can also influence your pain. So with a shoulder problem, it's more going to be the position of your sleep that is going to affect it, and namely if you're compressing it.
Okay, thank you. And the final question in this section, should one be concerned if extra bone starts growing on the top of the acromion?
Sometimes that can cause pain. I think if you haven't got any symptoms, then it's not something to worry about. But if you are starting to get symptoms from it, so if, bringing your hand up over your head or across your body is starting to give you pain, then I would go and see your GP about that.
Thank you.
Okay, great, no worries. So we're going to move on to talk about back pain, which is quite a big issue. So it's the largest single cause of disability in the UK, with lower back pain alone accounting for 11% of the total disability of the UK population. So that's a huge impact on not only the NHS, but people's workforce. People are having to take a lot of time off work because of back pain. So it's good if you know how to manage it when it does come. And, this can hopefully give you some tips so that you can prevent getting back pain if you don't have back pain. So acute back pain, that is a sudden onset of back pain which lasts up to 6 weeks. So it comes on quite suddenly. It might be due to an injury. So for example, if you're lifting something quite heavy and your back wasn't ready for it, it can then cause acute back pain. Sometimes it's not really due to you lifting anything. It could just be due to stretching or doing something relatively normal. Sometimes that can still set the back off. It could be due to an exacerbation of a pre-existing condition, so something like osteoarthritis. If you've got arthritis in the back, sometimes you can get a flare-up, which then would come under that acute back pain category. Management of acute back pain. So, sometimes it can get better within a couple of days, just kind of naturally. But if it's lasting up to a couple of weeks or maybe 6 weeks, then you need to be careful so that you don't make it worse. So we advise relative rest. And this is not bed rest, because we know that bed rest will make it worse, because if you're just in bed and you're not moving for a long time, you'll get stiff, and that can cause even more pain when you then need to start moving again. So relative rest is just rest from the aggravating activities. So if you've got pain, when you're going up and down the stairs, then you might need to reduce how many times you're doing that. But, everyday functions like going to the toilet, having a shower, you need to do that. Pain control. So again, whether that's ice, heat or medication, you do whatever you need to, whatever feels right for you. Sometimes with the ice and heat, it is personal preference. You might want to use heat. Sometimes you might want to use ice. Sometimes using one after the other might make more of a difference. Gentle stretches as soon as is comfortable. So you can see the pictures below. These are just some of the stretches that I've given out over the years that can be quite useful in just encouraging movement in the spine if you have had like a back spasm or a flare-up of back pain. And then the other key thing is to remember that when you do start to return to your physical activities, is that you do it gradually. You don't just sort of go straight back into going to the gym, lifting all the heavy weights that you were lifting if you've had a few weeks off. You need to gradually return to that. Okay, so another type of back pain which I see a lot of is what we would call mechanical back pain or non-specific low back pain. So this is a pain which comes and goes. It's not there all the time. It's brought on with certain activities. So for some people, it might be gardening, it might be lifting. The key with this one is that it improves with rest, or it improves with you avoiding those activities. I've put here the pain is mainly in the back area, but sometimes it can sort of spread to the buttock or just the top of the leg. This is managed slightly differently. So it's managed with a specific exercise program aimed at improving flexibility in the spine and increasing the strength of your core and leg muscles. So what we do tend to find with people that have mechanical back pain is that there tends to be a lack somewhere. It could be that they're quite stiff in their lower back, or it could be that their leg muscles and their core muscles are quite weak. And so therefore their back muscles start to kind of overwork, and that's when you can then end up with mechanical back pain. So from my point of view as a physio, I will be prescribing the exercises that meet that lack. So if you've got weak glutes, which are your bottom muscles, then I'll give you exercises to strengthen your glutes and so on. So things like Pilates can be quite good for something like this, because that helps to target not only your bottom and your hip, but your deep tummy muscles as well. Right, so now we're going to talk about, this is kind of related to your back, but the pain can be lower down. So radicular pain. So this is pain that radiates along the course of a nerve root. So sciatica, some of you that may have had it or have heard of sciatica, that is a type of radicular pain, because the pain goes all the way down the length of that nerve. So it can start at the back and go all the way down the leg until the foot, okay? So people that have sciatica, radicular pain might say that it's a burning pain, throbbing pain. They might describe it as electric shocks, and they might get tingling and numbness. So because it's to do with where the nerve root starts, you can get radicular pain in your arms as well. So if you think about the nerves which supply your arms, they start in the neck. So if you've got a problem with the neck, that can then cause pain in the arms. So the signs and symptoms, so kind of said it already. So pins and needles, numbness, burning pain, and weakness. Those are the main symptoms that you see with nerve issues or nerve conditions. So the causes of radicular pain or another sort of nerve condition. So one of the things that may be responsible is a disc bulge or a disc prolapse. So the picture that's positioned to the right of the screen is a top view of a spinal vertebra and the disc. So imagine you're looking down through someone's spine. So the grey area at the top is the disc, and the yellow bit here is the nerve root. So if the disc is bulging enough that it's causing that nerve root to get compressed, that might then cause sciatica. But this is quite rare, to be honest, to see a bulge like that. Sometimes you can get nerve irritation from joint stiffness. So if you see these bony points here, the vertebra above that level will join onto that there. So that, where you think about that joint, that can be quite prone to getting stiff. If anyone's got osteoarthritis in their back, those are the joints that can be affected. So joint stiffness and muscle tightness, all the muscles that are surrounding the back, can be a cause for the nerve to get irritated as well. So treatment for nerve pain or nerve issues. Time is, I guess, one of the main things. That's just because these things will get better with time. It's difficult to say, but normally nerve pain can be there for about 3 months minimum, sometimes less, but from what I've seen, it takes quite a while for the symptoms to settle down. Cold packs, so where the nerve has been irritated, normally, again, there's lots of inflammation at that site. So putting some ice on it, taking medication that will help to counteract that inflammation can help as well. But then also just taking medication, targeted at getting on top of your pain can help. Gentle exercises when able. So again, trying to stretch out those stiff areas, trying to strengthen those muscles will help. And what I've put here is a TENS machine. So for those of you that don't know what a TENS machine is, that's what this picture is here on the right. So it's a machine that uses sticky pads. So you just stick the pads onto the area that you want to target, and it sends little electrical impulses. And the idea behind TENS is that those impulses will get up to the brain before the brain has a chance to send out any pain signals. So it may not help. There's not a lot of evidence to support TENS, but if it does help, then it can be quite useful. There's no side effects from it. The only reason why you shouldn't be able to use TENS is if you have a pacemaker, then because obviously it's electrical current, so you wouldn't want to disrupt any problems there. But with nerve pain, if it doesn't get better, you should really go and seek help from a GP or physiotherapist, just because if it's not getting better and your symptoms are getting worse and there might be signs of weakness, numbness, then there might need to be a bit more of a medical intervention. Okay, so for the last section of this pain element, we're going to just talk about persistent pain. So persistent pain is pain that's been there for longer than 12 weeks. So it's not going away. It's not acute, because acute pain is 6 weeks or less. And it's there despite you trialing medication. Symptoms can be variable, so you can have good days, bad days, but ultimately there's always some level of pain there. It doesn't go away completely. And it can result after surgery, after trauma, or it can be related to a long-term condition. So something like fibromyalgia or rheumatoid arthritis can have persistent pain as a kind of a side effect of that condition. The important thing to note about persistent pain is that it is not an indicator of tissue damage or of any sort of ongoing injury. So, the fact that it's been there for 12 weeks or longer, if we think about the body's healing process or healing timelines, any injury will get better within 3 months. So even, a fracture, within 3 months, that healing process would have been a significant way in. So it's not an indicator of tissue damage. Part of the reason why the pain persists is because the nerves get hypersensitive. So your body is responding to things that shouldn't normally be painful, but your brain is sending out pain signals because the nerves are hypersensitive. And unfortunately, that can lead to a reduction in physical activity because the pain is limiting you from doing things. So then you avoid doing certain things, and that can lead to reduced fitness. It can lead to you becoming weaker and stiffer as well. So it's quite it's more of a holistic approach to managing persistent pain, because it's not just a physical condition. It can be affected by mental health as well. So the first thing you need to do to manage it is to actually accept that you have persistent pain and not keep sort of searching for that diagnosis or alternative diagnosis. I see a lot of people that have persistent pain that are still sort of wanting lots of scans and investigations because they think that there's something going on that is causing their pain. But actually it's just, as I said, the nerves are being hypersensitive, and there's other things that contribute to it. So for example, your brain can remember a lot of things which have caused you pain in the past, and then it can cause you to feel pain again for things that shouldn't normally be painful. So it's those sorts of things that are feeding in, which can lead to persistent pain. So apart from accepting that you have it, you then need to start doing regular exercise. So this is to counteract the deconditioning that I was referring to earlier. So, if someone's got persistent pain, they're not really going to be as active. So doing regular exercise will prevent you from being weak, prevent you from getting stiff. And so then when you do start to do things which are a bit more physical, that then doesn't cause you pain. Emotional and mental health support. So, not surprisingly, people that have persistent pain often struggle with mental health. So making sure that you're getting the right support, whether it's through a mental health service or, you know, doing some relaxation, whatever you need to do, reading a book, having a hot bath, doing those things to look after your mental health and well-being will help definitely. Pacing, so similar to when we were speaking about osteoarthritis, you need to break the boom-bust cycle. So that is where, you know, if on a good day, you do a lot because you think, okay, great, I'm feeling the pain isn't as bad today, so I'm going to go shopping, I'm going to clean the house, and then I'm going to do my exercise, I'm going to pick up the kids from school. It just gets too much. So you need to have, you know, regular breaks. You need to do what you can manage so that when you do even have a bad day, you're still able to do a certain amount of activity. And then finally, pain medication. It does have its place. You know, a lot of the stronger medications do give you some quite, you know, not nice side effects. So, you know, if you're on a lot of medication and you don't feel like it is actually making a difference, then you might need to speak to your GP or your doctor about that. But if you're on medication and it does help, then, you know, I would advise you to take it so that it enables you to, you know, to function well and to be more active. Okay. If we take a question break.
Okay. The first question here we have is, I have Bertolotti syndrome, lower back L5, S1. I was born with it, and my back spasms are worsening. What can help with back spasms?
I haven't actually heard of that syndrome before, but with back spasms, if the muscle is really tight, then doing some gentle stretches might help. But, you know, I think this is a really good question, because if you've got a spasm or if you've had a spasm, the muscle is then going to be quite tight to begin with. So stretching a muscle that's already quite tight is like pulling an elastic band that's got knots in it. So what you need to do is kind of optimize that. You optimize your muscles before you start your stretches. So what I would normally say to my patients is put some heat on it, or maybe do some cardiovascular exercise. So just go for a walk, just to get your blood flowing first, just to loosen up the muscles a bit, and then start to do some stretches. That should be better than kind of just starting to do stretches from scratch. But, you know, if you're really struggling with spasms, and sometimes they can be too bad that you actually can't get, you know, you can't do any stretches because it's that bad, you might then need to see your GP or doctor about, you know, medication just to help for the short term, to enable you to do your exercises. So that's what I would say. It's trying to loosen up the muscles first, then stretch. But if that's not an option, then try and go on some medication potentially for a short term.
Thank you. The next question is, why do I still have back pain even with the use of an orthopedic mattress?
So again, that's a really good question. I think sometimes with mattresses that, you know, you're sold something that should really help with your back pain, but, you know, mattresses, it's really down to personal preference. Some people can have a firm mattress and, you know, it makes such a big difference. Some people can have a firm mattress and it actually doesn't change anything. So it depends what your problem is. Obviously, I don't know that your condition, but I think mattresses, it is down to personal preference. I don't want to say try another mattress if you've tried lots of different ones, but, you know, orthopedic mattresses aren't a guarantee that you will have a good night's sleep, unfortunately. But try different positions. Maybe try a mattress topper that will make it a bit softer if you haven't tried that before, because it could be that you need a softer mattress as opposed to a really firm one, because I know orthopedic mattresses tend to be quite firm. But also, sleeping with too many pillows is something that could be affecting you. I don't know if you sleep on more than 2 pillows, but I generally would advise people not to sleep on, you know, more than 1 or 2 very thin pillows, just because that is then going to make your neck quite a bit higher than the rest of your spine. So the reason for pillows should just be there to fill the gap between your head and the bed. So, you know, maybe try changing the pillows or trying a topper.
Thank you. Can a painful sacrum caused by sitting for too long, standing for too long, or walking for too long be remedied by exercise?
If it's something you haven't tried before, then yes. Sometimes it might be due to, tightness or stiffness. If you're sitting for too long, and that's what's causing pain in the sacrum. So the sacrum is kind of the lowest part of your back, just before your tailbone, the coccyx. That could just be because your back is quite stiff. It's taking too much load at that point. But pain with walking for too much, did it give a time? Did it say half an hour or something? Or did I make that up?
Just said too long for walking.
I just said walking for too long. Okay, yeah. So that could be a sign that maybe there's some weakness somewhere. So when you've overused something, it's getting a bit irritated. If it's just when you're doing things, then exercise would be a good place to start.
Thank you. Are there any links between neck pain and peripheral neuropathy?
There can be some links. So if there are if there's some changes in the discs, potentially that can cause some nerve issues further down into the arms. But sometimes peripheral neuropathy can be due to other conditions. So if you've got diabetes, that can sometimes lead to peripheral neuropathy as well. But there is some links.
Thank you. Can multiple births also cause back pain?
So when you have gone through a pregnancy, your ligaments get lax, obviously to make space for the baby and make sure that your pelvis is able to widen enough. And when you have given birth, when mothers are breastfeeding, a hormone called relaxin is secreted, which again makes your ligaments more lax. So it is often seen that after mothers have given birth that they get a bit weaker, their core is not as stable. So it's really important that in between pregnancies, you do your best to get as strong and as fit as you can be. So if you've had if you've had more than one child and you haven't really done much exercise or strengthening to get your core strength and pelvic floor strength back to what it was, pre-pregnancy, then that could be a reason why you've got more pain now.
Thank you. The last question here says, what can I do about both of my legs, which give me a burning sensation?
Okay, if it's a new thing, because the fact that it's in both legs, I would definitely go and see the GP about that, because if it is a sciatica type symptom, the fact that it's in both legs, you'd want to get that investigated sooner rather than later. If it's something that's ongoing that hasn't really changed, again, I guess burning is without more information, it's quite difficult to know if there's any sort of physio tips that can help. But I think if it's burning in both legs and you haven't been to the GP about it yet, then go and see the GP. That would be my advice.
Okay, thank you.
Okay, I don't think we've got much left, actually. It's just going to cover a quick topic, which I think is quite relevant considering the times that we're living in with more working from home. So it's just talking about something called workplace ergonomics. So that is just, your positioning, whether it's at your desk or, your computer, what is your setup like there? So these are just some very bad examples of workplace ergonomics. So you can see this person here, they're quite rounded, their elbows and hands are quite far in front of them if they're going to be doing that for a period of time. Their neck is poking forwards and that screen probably isn't at the best position there. So another example, if you're on the phone and you end up being on the phone for a long time, this can lead to neck pain potentially because you're leaning and stretching one side too much and then you're compressing the other side. So that's not the best position. You want to be having a headset so that your head can be in a neutral position. So again, we've got a bad position here. So we've got an example of what you shouldn't be doing. Then we've got a better seated position. And then we've also got a really nice option here, a standing position. But the thing to think about with posture, even though I'm trying to encourage you to have a better posture, the best thing you can do for yourself is to move regularly, is to get up and move every 20 minutes. Realistically, you don't want to be seated for longer than 20 minutes and do that consistently. That is one of the best things that you can do, is just to move around a bit more. So there's different things to take into consideration when you're sitting at a desk. So you want to make sure that the monitor is at eye level, or your screen is at eye level, so that you're not having to look up, you're not having to look down. Your arms, you want to be able to have a relaxed position. You don't want your wrists and your elbows to be quite high. You want your forearms to just be on the table in front of you. You shouldn't have the keyboard too far in front of you either, so that you're stretching. You want to have your keyboard just at the right level so that you can just type. You want to have the chair, a good chair, a supportive chair that supports your back, so you then don't end up slumping down. So whether you need to get a rolled up towel, if you haven't got a proper desk chair at home, it might be an idea to get a lumbar support, or you can sometimes just get a towel and roll it up, or a cushion, and just put it at the base of your spine, and that will just maintain the natural curves in your back and just give you a bit more support there. With your legs, you want to try and keep them parallel to the floor, so you don't really want to have them too low or too high. You don't really want to cross your legs for too long, just because that can sometimes lead to strains and things like that. And also with your feet, you want to try and keep them parallel to the floor. So you can use a footrest if necessary. But again, as I said, the key is to keep moving. Don't sort of think, okay, I've got my ideal posture and I can stay here for 3 hours. No, that's not what you want to do. So yeah, these are just some points to remember. So support your back, adjust your chair. So, if it's too high, make it lower. If it's too low, make it higher. Place your screen at eye level. Have your keyboard straight in front of you, so not to the side. Make your objects easy to reach that you're going to use. So whether it's your mouse, telephone, have it close to you. And then the most important thing is taking regular breaks. Okay, so that's actually the end of the presentation. So if anyone's got any other questions, you can just do that for the next couple of minutes. I'm not sure how much time we've got, Pastor.
Well, we have one question left, actually, which we can take. And it reads, is it best sleeping without pillows when having shoulder pain or back pain?
So everyone is different. I would say if you can, then it might be worth trying it. Back pain depends where in your back it is. If it's your mid-spine, so in between, or I should say your thoracic spine, so in between your neck and your lower back, that will be in more of an extended position if you don't sleep with a pillow, which might help, depending on what your problem is. If you're having shoulder pain, if you sleep on your back, then your shoulders shouldn't really be compressed. But if you're someone that can't sleep on their back and you have to lie on your side, then you might just find you keep tossing and turning. But yeah, I think if you could try and sleep without pillows, that will actually give you a nice neutral alignment for your spine, so your neck, your thoracic spine and your lower back.
Okay, thank you very much. That was the final question.
Okay.
I just want to thank you, Karina, for your presentation, and we trust that our online viewers have taken it all to heart and made good notes, but it's been extremely informative, and we pray that God will continue to use you and to bless you as you minister in your profession.
Thank you.
Okay, let's just bow our heads as we pray. Dear, kind and eternal Heavenly Father, in glory and honor to your high and holy name, we thank you for the blessing of this day and for the presentation that we have just received. And we pray, Heavenly Father, that the information that has been shared will be remembered and will be helpful indeed for those that have taken note. Please be with us now as we move into our next service. And we pray that above all, your name will be lifted up and glorified. For we ask these mercies in Jesus' name. Amen.
Amen.